Surgery panic attacks are very real and can be dangerous. What breaks my heart though is that when patients come into an operating room like the one that we're going to go into right now, they don't believe that they can control their anxiety to help prevent that from turning into a panic attack. Well, the truth is that even in the most stressful situations, like being in an operating room like this one here, with the bed, with the ventilator, with all these strange medications and breathing tubes, you can still have incredible control over your anxiety to help prevent panic attacks from blossoming. And not only can you control your anxiety, but you can also control the complications that can come from it. Things like worse nausea, worse pain, even surgical complications from the interaction between high anxiety and anesthesia in surgery. So today, I'm going to share my top 3 favorite techniques that you can use to help harness your anxiety and get it under control to prevent those complications from happening. And the best part is that they're all natural. So I'm going to talk about supplements, essential oils, mind-body techniques. I'm also going to share with you a dirty little secret that the essential oils industry uses to maybe have you spend more money than you need to on certain aromatherapies to get those anxiety benefits. And stick around until the end where you'll actually see me here connected to the life support monitors. I'm going to demonstrate with you on my own body. I do it with my patients all the time when they're in this room here with this scary looking machine and the breathing tubes and the masks and the tubing. And the goal here is never to replace our anesthesia medications, but with these techniques, you can lower the dose requirements for yourself so that you have less chance of maybe being awake during surgery, less chance of needing more medications that have their own side effects. You can help use these techniques and lower your medication requirements. If you're appreciating what I'm sharing, do please hit the like button, share with others, and subscribe to keep up with all these videos that I share that show just how much power you can have over your body, because it's probably more than you've ever been told. We usually don't recommend any supplements before surgery in anesthesia. That's because of the potentially dangerous complications that supplements can have, things like worse bleeding or anesthesia interactions that can be very dangerous during and after surgery. That being said, there are 2 supplements that can be safe in the right patient populations. You've probably heard of melatonin as the sleep hormone. It can do a lot more than that though. It can be a sedative, it can be a pain reliever, it can have some antioxidant properties. All put together, melatonin can be very helpful for helping sleep, anxiety, and pain. Sleep, anxiety, and pain are really important here in surgery because surgery and anesthesia disrupt sleep, cause worse pain, and can cause anxiety. It's why you're probably listening to this video right now. But sleep, anxiety, and pain also interact with each other. The worse sleep you have, the more anxiety you feel. The more anxiety you feel, the more pain you feel. These 3 all go together. So anything that we can do to get in the way of one of these can help lower the other 2 as well. That's where melatonin can come in the right patients, but you need to talk to your doctors first. Second is magnesium. Magnesium is a powerful mineral found all over your body, but did you know that it can also have anesthetic-like properties? That's right, it's also an NMDA receptor antagonist like ketamine and nitrous oxide. Like it's one of the gases that comes out of the ventilator that you see behind me. I always recommend you get your magnesium from whole food sources. If, however, you are deficient before surgery, I might recommend that you start supplementing. It can be very safe, but you do need to talk to your doctor first because it can be dangerous in certain patients, particularly those with kidney disease. So it turns out that the things that you listen to and the things that you hear can heavily influence your anxiety. And believe it or not, simply listening to music can actually be very beneficial even while you're waiting for surgery. The trick is that there is no trick. There's no type of music that's been shown to be better than other types of music. So it's not like Mozart is better than Bach, which is better than Pink Floyd. It's really whatever resonates with you. There's also things like guided imagery where you can take an active role into harnessing your brain's creativity to help treat your own anxiety and pain. If that sounds kind of crazy, it's because it is. Pain-relieving properties of guided imagery are very real, on par with 5 milligrams of OXYCODONE, without the side effects of opioids. Now for 2.5, because I just have to talk about essential oils and aromatherapy, because aromatherapy is kind of like anesthesia. You're inhaling some aromatized essential oils, they're going into your lungs, going to the rest of your body, and ultimately hitting your brain, and that's how we believe they have some of their anti-anxiety and relaxing properties. The trick is that what essential oil do you pick and how do you use it? Here is this dirty little secret. Turns out that it might not be the essential oil at all that's helping with the anxiety. It might just be from the mindful breathing alone. Breathing without any essential oil, or even breathing like an alcohol pad, can perform pretty well, which makes me think that maybe it's the breathing that's behind the anti-anxiety and the anti-nausea effect. So, if you're gonna use essential oils, sweet marjoram, ginger, mandarin, and lavender have the best evidence for helping with anxiety, and you wanna breathe in a mindful way. You inhale for 3 seconds, you hold your breath for 3 seconds, then you exhale for 3 seconds. Then you do that again 3 times. If you're still anxious, you can repeat the whole thing again 5 minutes later. All right, now we move on to number 3, and this is my absolute favorite trick. Okay, so I put the camera down for a minute so I can actually show you that I'm gonna put these EKGs on myself. And you're gonna see how breathing is gonna change my heart rate variability, and ultimately help me feel more relaxed. Okay, so here we go. Here is my EKG here in green. If you look closely, you can see the big spike. Look at the big spike, because that's showing every time my heart beats. So I've now raised the volume of the beeping so you can in real time hear my heart beat. As I'm speaking and breathing, you can hear my heart rate changing, right? This is a fundamental part of biofeedback, and I'm gonna do it on camera with you guys. Now, I'm gonna do one of my breaths. Watch what happens to the spacing between my QRS complexes. You ready? 1, 2, 3. You can change the distance between your QRS complexes, which more practically means changing your heartbeat. And when you change your heartbeat, that feeds back to your brain, and that can affect your anxiety to help curb a panic attack, even in a stressful room like this, with these lights, with this scary looking, I mean, this is a pretty ancient machine here, but still, it's like a ventilator, all these medications, these breathing tubes, these things that go in your mouth. Like, this can be a stressful place, I get it. But you can have control over the most fundamental parts of your body, like your heart, your blood vessels, your brain, with something as simple as what I showed you. Now, how did I do that? Let me tell you what I did. I breathed in for 5 seconds through my belly, right? So when you're anxious, you tend to do rapid, shallow breathing, but you need to break that. When you recognize that you're anxious, you might feel yourself breathing shallowly and breathing with your chest moving. So what I did when I first started was I would put my hand over my chest and try to breathe without moving my hand. That would force me to breathe through my belly here, like that. I breathe in for 5 seconds and out for 5 seconds. So if my patients can accomplish this in the operating room with me, with all these lights and tubes and scary monitors and all that, you can probably do the same outside the operating room in probably less stressful situations as well. Thanks for watching. I hope you learned something. If you did, be sure to follow and share with your loved ones. And leave comments below and let me know what other secrets you want to know about the human body so that you can control your inner healing potential.